when there is a pandemic. If we didn't do what we do, there would be nobody else to do it.
We've got more than 53,000 nurses and midwives in New South Wales Health. We're there 24 hours a day, 7 days a week. Every day in New South Wales there's more than 65,000 people who are cared for right across the spectrum of where we provide care. So that's in our emergency departments, inpatient areas and our communities as well.
Are you feeling better? Yeah? We're here for you, okay? Making sure you're safe.
Nurses are superheroes in some ways, but we don't see ourselves as that. We see ourselves as ordinary people coming to do the best that we can every single day.
Nurses, I suppose they're almost the molecular glue that kind of gets that relationship happening between the patient and the nurse and equally keeps the patient safe. All right. Now, you're going to stand up? They monitor, they assess, they intervene.
We're there because we really want to make a difference, and we're there because we want to make that human connection.
Do we know what drug he took when he felt unwell? I am proud to be a nurse because I think it's a job that not many people can do. And I think nurses are special people, and I'm proud to say that, and I'm honoured to be someone that can fit that criteria.
Mum said, "Oh, why don't you do nursing?" And I kind of laughed, and I thought, well, maybe I'll start off with nursing. Ever since I learned so much more, and there was more a depth of treating our patients. So ever since then, I stuck with it, and yeah, I'm pretty happy where I am. So it's a good choice. Thanks, Mum. Yeah. Thanks, Mum.
Some of the patients I've looked after, they'll be with me forever. Looking after a 90-year-old lady who was dying, it wasn't a complex case. There was no inotropes, there was nothing that interesting going on. And her husband in his suit jacket sitting by her bed saying to me, "Oh, isn't she beautiful? I've loved her since she was 16 years old. It'll always be with me."
You know, there's different sides to nursing. There's the clinical side of nursing, which is doing medications, that sort of stuff. But there is quite a big person-centred side to nursing. Being able to communicate with patients, being able to have, sympathy at difficult times for patients and their families.
As nurses, we are really quite privileged. We see people at their most vulnerable. They will share things with us that they may not have shared with other people. And it is, our privilege, I guess, to use that and to work with people.
I tell everybody I'm a nurse.
It was fantastic. So
I'm proud to be a nurse because it's a really important thing to make sure that people are safe.
If I can make a little smile and take a little worry away from them, that's all I want. And then I feel like, yes, I've done a good job today.
The best part about it is when you help someone. If someone comes in crook and then they go back and they're feeling 10 out of 10, you feel good because you're like, I helped them become this. And I think that's the best part about it.
I want to say a really big heartfelt thank you. We started off this year looking at a year of celebration for our nurses, and we've been thrown a curveball. I know that it's challenging for us all out there at the moment, and it doesn't really feel like a time to celebrate. But what I'd ask you all to do is just take some time for yourselves. What I've seen is us band together, and that's the great thing about nurses. We're there to support each other, and we're a community, and we're a family.
If I can make a difference in one person's life today, then I will go home a happy person.
I think the nurses have a great impact on my life because they make the hospital seem like a family.
How are you feeling today, Jo?
They care so much.
When people give you that thank you, it makes it worthwhile.
Yeah, I had someone hug me on the street once.
Get out.
Okay.
Yeah, I've been a nurse for 7 years.
44 years? Be looking over 10 years.
I've been a nurse for about 4 weeks now as a new grad.
And I've never looked back.
I've been a nurse for 5 years now. Wow, that went quick.
There's lots of reasons why I'm proud of the nurses of New South Wales. I'm proud because they are professional. I'm proud because they are motivated in what they do. I'm proud because they want to make a difference and they step up to the challenge. We've seen that, and that's why I'm proud.